Welcome to Dental Talks, episode 3. So, in today's episode, we're going to be talking about Macrognathia. Macrognathia, simply put, is just large jaws. An increase in both the jaws is quite common because it is associated with a generalized increase in the size of the skeleton. Exhibit A, generalized increase as seen in pituitary gigantism. A giant will have larger jaws, naturally. More commonly, only the jaws are also involved. That is seen. But there are certain conditions with which macrognathia is seen more commonly. The first of these is Paget's disease. Paget's disease is generally an overgrowth of the cranium and the maxilla, or occasionally the mandible. So Paget's disease is one important thing. The second is acromegaly. Acromegaly is a progressive enlargement of the mandible and in general many other structures. It is due to hyperfunction of the pituitary glands. Then comes leontiasis ossea. So leontiasis is a lion-like appearance and ossea is because of the osseous activity of the facial structures. So it is a form of fibrous dysplasia in which there is enlargement of the maxilla which makes the face appear more lion-like. And there are cases of mandibular protrusion or prognathism which is uncomplicated by any systemic conditions whatsoever. So it is rather common to clinically observe these things, and it does follow a hereditary pattern. The father has it, the child may. Now the size of the maxilla also plays a role in the appearance, correct? So there can be situations in which the maxilla is just too small and the mandible just appears larger than it actually is. And in these conditions, the angle between the ramus and the body also appears to influence the appearance of the mandible. Now, what other thing that we have to look at is macrognathia at particular positions. Now, the condyle may be involved, the ramus may be involved, and the body may be involved. Now, how do I say that? So now, some of the common reasons could be an increased height of the ramus. The ramus is the part of your mandible between the condyle, the connecting link, and between the body and the condyle is the ramus, correct? Now, an increased height of the ramus would make the mandible appear larger than it is. The second thing is an increase in the mandibular body length. An increase in the length of the body of the mandible can also make the mandible anteriorly positioned. And an increased gonial angle, which makes it more oblique, makes it appear larger than it actually is. And definitely the anterior positioning of the mandible definitely makes it look like it's larger than it actually is. One other thing is the posterior positioning of the maxilla in relation to the cranial base. Because if the maxilla is posteriorly placed, the mandible just appears to be anteriorly placed, doesn't it? Now, definitely you are going to observe clinically some prominent chin buttons and varying soft tissue contours. Now, why do I say this? Now, it's because there's a larger mandible, so your tongue activity is increased because it has more space, more freedom. So you will also see macroglossia. Now, the lips have to accommodate the larger gap between the upper and the lower interfaces. So what happens to touch the upper lip, the lower usually gets larger, and you might or might not have competent lip closure or a lip seal. Now, as a mode of treatment, surgery is considered as a very important modality because surgical corrections are both feasible and gives you a good functional results. Ostectomy, in which resections are performed in certain portions of the mandible, provide you very good aesthetics and function. So in terms of that standpoint, surgery is your best option. So this was agnathia, micrognathia, and macrognathia. So see you in the next video. Have a nice day. And as a bonus point, you're going to see some of the pictures of Paget's disease, that is here. Acromegaly, that's here. Leontiasis ossea, that's here. So have fun. Have a nice day. Ciao.